So in today's topic, we will be discussing about anemia. This is not from the textbook. This topic is not from the textbook. If anyone is joining late, please help them out with the topic name. So what is anemia? Anemia happens when you don't have enough red blood cells, or your red blood cells are not working as they should. They are not functioning properly. Okay. And what are red blood cells? What do? They carry oxygen throughout the body because red blood cells contain this pigment called hemoglobin. Okay. Hemoglobin will help carry oxygen throughout the body. Okay. And oxygen gives your energy to the cells. Okay. The presence of oxygen, it gives energy to the cells, and without any healthy red blood cells, your body will not get the energy that it requires to function, which means you in turn will be in a very low energy state. Okay. Some types of anemia are short term and mild, others can be for a lifelong. Okay. And if especially if you have left it untreated, it could be life threatening as well. Okay. And anemia affects different people in different ways. Newborns, some small children, newborn babies, they are born with low blood cell counts because majority of the time their mother was anemic. Okay, in such cases, newborn babies are also born anemic. In most of the mild anemia cases in newborns, treatment is not required much, but in severe case of anemia in newborns, even the newborn baby may require blood transfusion. Infants may get less iron as they're completely dependent on breastfeeding for the first 6 months, and breast milk is not a good source of iron. Only when they start eating solid food after 6 months, slowly, when they are introduced to solid food, that's when they are able to absorb iron. That's when iron comes back into their diet. Okay. And infants who are anemic, they may appear quite lethargic, very tired. Children do a lot of growing between the birth and till the age of 2. Okay. And there is a growth spurt that is taking place in this age period. Okay. And if iron requirements are not being able to keep up, okay, through your diet, you're not able to keep up your iron requirements, then the children may develop anemia. And it can affect their motor skills as well. There will be issues with learning as well. Women who are pregnant, women who are pregnant may also develop iron deficiency anemia, which may increase the chance of complication like premature birth, giving birth to babies who are low birth weight, stillbirth. Okay, preemie babies, low birth weight babies, stillbirth. These can also happen. If women who are pregnant, they are anemic. These are the complications of anemia in pregnancy. People born as women, okay, when there is no gender change, okay, people who are born as girls, women, uh, once they start menstruating, okay, and those who have heavy periods, and once they start menstruating, they have a higher risk of developing anemia. And other conditions like uterine fibroids and all that can also cause you to lose a lot of blood. People at the age of 65 or older than 65, people over 65, they are more likely to develop like iron deficiency anemia, more likely to have iron poor diets as well, because there is malabsorption. They are not able to absorb iron properly from food, and because of which there is an increased risk of developing anemia. And if they develop anemia, their heart conditions, okay, general weakness, these things can make it hard for them to get around, do their own stuff. They will be dependent on others usually. Confusion, depression, other mental agonies, okay, that can start. People with any chronic conditions like autoimmune diseases or cancer, that can also increase the risk of anemia. In that conditions, your own immunity is attacking your red blood cells in any one or the other way. Okay, immunity tends to attack the red blood cells, so that could make you anemic. And anemia is very common. It affects at least one third of the population, usually women. Okay, 67.3% of women alive are anemic today, especially those who are in the reproductive age group are anemic. Only 32.65% are non-anemic. And in male population, you can see it's just the how different it is. 4.7% of men are anemic, 93.3% of men are non-anemic. Types of anemia, there are nutritional anemia, inherited anemia, anemia caused by abnormal red blood cells. Okay, nutritional anemia, because of your diet, you got anemia. Inherited anemia, you're born with it. Okay, and abnormal red blood cells, there are, it is not because of nutrition or anything that you have inherited, maybe some drugs that you're taking or your autoimmune diseases that you have got later on in life, these can lead to anemia. In detail, we will see nutritional anemia. One type is pernicious anemia. Here it happens because of vitamin B12 deficiency. Okay, vitamin B is not able to be absorbed from from your stomach, and that deficiency leads to pernicious anemia. And this is an autoimmune condition in which your body is not absorbing vitamin B. Then you have iron deficiency anemia, as its name implies. Iron deficiency anemia happens when your body does not have enough iron to make hemoglobin. Hemoglobin is a substance that your red blood cells requires to enable your body to carry more oxygen throughout the body. If iron deficiency is there, the bone marrow is not able to produce enough red blood cells. If you don't have enough red blood cells, hemoglobin content won't be there. And hemoglobin is responsible for carrying your oxygen to the cell. You can see here normal blood, iron deficient anemia blood. Megaloblastic anemia. Okay, it is a type of vitamin 12 deficiency, or vitamin B9 as well, folate or vitamin 12 deficiency, that could lead to megaloblastic anemia, which means large immature red blood cells are being released by the released by your bone marrow. Immature RBCs are released. Always immature RBCs are released at least 1 or 2 days when the RBCs are in your blood after few days of releasing. That's when the RBCs also mature. Okay. But usually in megaloblastic anemia, RBCs are not able to mature. Even after being in the blood for more than 2 days, RBCs are not mature enough. Okay. You can see the picturesque representation of normal blood and anemic megaloblastic anemia blood. Then coming to inherited anemias that you are born with, you have sickle cell anemia. You can see the shape, how different it is. It is like a sickle. Okay, that half crescent moon shape is there. No, that is a sickle shape. Okay, the sickle, that's how it got the name sickle cell anemia. So usually your RBCs, even if they are cells, they are very flexible. Okay, they can pass through any smallest capillaries and all, very easily it can pass through. But in sickle cell anemia, since it does not have a disc shape, okay, they have this half moon crescent kind of shape. The movement and the flow of the sickle cell anemic blood through the veins becomes difficult. Okay, it can get stuck also and cause more pain to the wherever it is getting stuck. Okay, wherever whichever blood vessels it is getting stuck, that area it will be quite painful as well. That is the sickle cell anemia. Then we have the Fanconi anemia. In Fanconi anemia, uh, there are some distinct features. Okay, they don't have enough height. They are of short stature. Okay, low set ears and deafness. Strabismus is the squint eye. Okay, the eyes are looking at different direction. You have some people with that condition, that squint eye. And skin hypopigmentation. Skin is very pale in color. Renal abnormalities. Bone marrow transplantation is the treatment required here to overcome Fanconi anemia because these are inherited. Okay. It's a very rare disorder. Then you have diamond blackfen anemia. Again, very rare. It keeps your bone marrow not to produce any more red blood cells. So, what is this disease condition? It's again a congenital inborn disorder in which the bone marrow does not produce red blood cells. There is a shortage of red blood cells, and we call it as anemia. And now, when there is a shortage of red blood cells, the person will be very lethargic, no activity, very tired, protruding shoulder blades, congenital heart failure, abnormal shortening of neck, short stature, heart murmurs. Those who are doctors, they will understand. Droopy eyelids, low set ear, small sized head, squint eye, that is strabismus, and also wide separated eyes, protruding upper lip. These are the signs and symptoms of uh, black Fanconi, anemia. So far, is it clear to all? Then anemia caused by abnormal red blood cells, hemolytic anemia, hemolytic. Okay, red blood cells are getting broken down. They die faster than usual. That is hemolytic anemia. And hemolysis, why it takes place, reasons are unknown. Some bacteria and virus can also cause it. Then aplastic anemia, this anemia happens when the stem cells that you have in your bone marrow, they are not making enough amount of red blood cells. So here that is a disorder not just of the red blood cells, but also of the brown hospital. And autoimmune hemolytic anemia, again here your immune system attacks your red blood cells. Reason again is unknown. Okay, these conditions also has to be checked and diagnosed and treated under the hospital care. Okay, they will also undergo regular blood transfusion. Reason is idiopathic. Sometimes it is some drugs also can trigger autoimmune hemolytic anemia. Some drugs can cause your RBCs to break down. Then we have sideroblastic anemia. It is because of too much of iron in your diet. Okay, or you're exposed to too much of iron in your body. Okay, that could lead to sideroblastic anemia because red blood cells, hemoglobin, it has a capacity to which iron molecules it can hold on to. Okay, red blood cells has a capacity. Okay, see, kind of a seating capacity. Only these many iron molecules we can carry forward. Okay, but sometimes they are overburdened by the amount of iron that is being introduced in the body. So that goes into sideroblastic case. Too much of iron toxicity. Then you have macrocytic anemia, big size. Okay, the macrocytic cells of the RBCs are much bigger and larger than the normal ones. And it is also a symptom of megaloblastic anemia. Then you have microcytic anemia. It happens when your red blood cells don't have enough hemoglobin, so they're very smaller than usual. Again, because of iron deficiency, this can happen. You don't have enough iron, you don't produce enough hemoglobin. If enough hemoglobin is not produced, the RBCs will not be of normal size, it will be of a smaller size. That is microcytic anemia. Then normocytic anemia, cell size, structure, everything is normal, but count is less. The number of RBCs that should have been present, that is less. That is normocytic anemia. So when normocytic anemia happens, or normocytic and normochromic anemia happens, you have to find out, okay, what kind of treatment you have to give. Okay, first of all, when somebody has normocytic normochromic anemia. Normochromic means the red blood cells are not either too dark or either too light. That is normochromic, normal in color. Okay, so you will do an appropriate reticulocyte response. That test you will do. Okay, and if there is hemolysis or bleeding, it is more of a genetic condition that has been passed out. okay, because of the family. And second reason is inappropriate reticulocyte response. It's negative. Then either inflammation is causing you anemia, organ dysfunction, liver, kidney, endocrine, human bones. Okay. So all these organs will undergo dysfunction. Inflammation can also cause anemia. If inflammation is not treated, inflammation can cause anemia. Just a minute, just give me a minute. Yeah. So when there is a normocytic normochromic anemia, you have to check if there is a reticulate response or not. That is a clinical test. Okay. Clinical test will be done just to find out if it is autoimmune, okay, or is it because of heavy blood loss, okay, or any other internal dysfunction. If the reticulocyte response is normal, it could be because you have lost a lot of blood or it is an autoimmune condition. If reticulocyte response is abnormal, that is because your own body's internal health or disease conditions or organ dysfunctions are causing this anemia. You have to correct your internal organs, other disease conditions for the anemia to be corrected. Okay. So, what are the symptoms of anemia? Fatigue, feeling too tired to manage your activities. Okay, that is the most noticeable anemia symptom. The other symptoms are like shortness of breath. It's kind of a feeling that you cannot catch your breath, or you can't, or you're not able to take a deep breath. Dyspnea, what we call, as in medical terminology, is not able to breathe, especially after doing any strenuous activities. Okay. Dizziness, lightheadedness. You sit for a long time, and immediately if you get up, you feel that giddiness. Okay, you become unsteady. Very common among women as well. That is dizziness because of anemia. Fast or irregular heartbeat, that is arrhythmia, cardiac arrhythmia, when your heart feels like it is racing, or it is skipping beats, or it is beating on your chest. Okay. And pounding or whooshing sound in your ear. Okay. You are not listening to anything, but simplicity, you can feel that there is a pounding sound in your ear. Okay. Pulsating sound in your ear. So, feels like wind is blowing inside your ear without the air, just the feeling of the pressure is changing inside your ear. Okay. So that is also another symptom. Headache are common, low grade migraines and all can happen. Pale or yellow skin that looks paler, not bright. Okay, there is no natural flush into the skin color. Okay, chest pain, like along with dyspnea, along with breathlessness, chest pain may also be there. Causes anemia. It's caused by blood loss, maybe any road traffic accident, internal bleeding. Okay, that too much of blood that has been lost after labor. Okay. mm, Giving birth, maybe the mother has lost a lot of blood, that could also push her into anemia. Or maybe your body is not producing enough red blood cells, some continuous infection or some issues with the bone marrow. Okay, that could be another cause. Then anemia caused by destruction of red blood cells, that is autoimmune, your own immunity is causing this. Okay. So blood loss, hemorrhoids, gastritis, inflammation in your stomach, cancer, ulcers, and also worm infestation. Children, in children, this is very common. Small kids usually tend to eat mud and all. They get worm infestation in the stomach. Through that also, these parasites also take away the blood. Okay, that could also lead to blood loss. Taking anti-inflammatory drugs, non-steroidal and anti-inflammatory drugs like aspirin, ibuprofen is a painkiller, okay, which can trigger any existing ulcers and gastritis more. Then women's periods, okay, heavy menstruation, that can also be linked to fibroids. And post-trauma, post-surgery, during surgery also, when there is blood loss expected, even if it is an expected blood loss, that could also lead to anemia. Any traumatic incident like road traffic accidents and all, multi-organ failure, multi-system injuries during delivery, labor, postpartum period. After delivery is the postpartum period. Anemia caused by decreased or faulty red blood cell production. That is your issues of the bone marrow. Okay, bone marrow and stem cells are not healthy. Okay, and iron deficiency anemia, when the body is not able to produce or store enough iron, or your diet does not have enough iron, and because of that iron deficiency anemia happens, that your bone marrow itself will not produce enough red blood cells because there is no iron. Sickle cell anemia, red blood cells are usually in the sickle shape, crescent moon shape. Okay, and that can get stuck in your blood vessels, cause pain. Okay, so here red blood cells are produced, but they are not of the correct shape. Okay, production number wise and all, it could be the normal count, but the shape is in the shape of a sickle, crescent moon shape. Okay, if only if the RBCs are in a disc shape, only then it can move across the blood vessels freely through the tiny capillaries freely, because it is bendable. Okay, even to the red blood cells are disc shape, the disc is bendable. Okay, but if it is some other shape like sickle and all, it cannot bend that easily. Okay, it can get stuck. Then vitamin deficiency anemia, especially B12 or folate. Okay, it occurs when there is a lack of vitamin. It causes the body to produce red blood cells that are too large and it cannot work properly. Vitamin B12 and folate, usually megaloblastic anemia we call it. We have seen it early. We have discussed this earlier. Bone marrow and stem cell problems. Aplastic anemia, it happens when you don't have enough stem cells or have none at all. Okay, this is the issues of the bone marrows. Okay, and the stem cells that are present in the bone marrow that give rise to different cells of your body. And why does these stem cells does not work? Either you are taking some medications that is depressing the work of the stem cells, or you have undergone some radiation therapy, chemotherapy as a cancer patient. Okay, or some multiple infections, some viral infections that has affected the bone marrow cells. Okay, like multiple myeloma, leukemia. Okay, leukemia is blood cancer. In these cases, aplastic anemia can take place. Lead poisoning. Lead is toxic to your bone marrow. Okay, lead is a metal. Okay, people who work in ores and all, mining ores and all, chemical factories, petroleum factories, they are more at risk of developing lead poisoning. Okay, it can happen in adults when they come in contact with lead at work. It's usually a occupational hazard. Thalassemia happens with the problem with hemoglobin formation. Thalassemia is also, it's kind of genetic. Okay. Uh, Here the body makes red blood cells, but it is very small size. Okay, and though there is enough number of red blood cells the body is able to make, okay, and usually there won't be any symptoms much, but it can be severe as well in certain cases. In thalassemia also, the patients will require regular blood transfusion. Okay, and it is a genetic condition. Coming to the causes of iron deficiency anemia, a diet without iron, especially in infants, children, teens, vegans, vegetarians, etc. Certain drugs, foods, caffeinated drinks, digestive conditions like Crohn's disease. If you had a part of your stomach or intestine removed, okay, in such conditions, maybe because of cancer, maybe because of any injury, okay, maybe it is a bariatric surgery that you have done. So a part of the stomach, if it is removed, that could affect iron absorption, because iron requires hydrochloric, the acidic environment like that your hydrochloric acid gives. Okay. Then donating blood often, every 3 months, every 2 months, if you're donating blood, that could lead to iron deficiency anemia. Endurance training, that is resistance training in the gym and all that you do for a pretty long time, that could lead to an iron deficiency anemia, because your blood RBCs are getting used up to keep up with the oxygen requirement. Pregnancy and breastfeeding, that can use up the iron stores in your body if you're not taking adequate iron supplements as well. Periods for women, heavy periods can lead to iron deficiency anemia. Any slow bleed that is happening within your body, like tapeworm infestation, or any peptic ulcers and all, bleeding ulcers, any form of ulcers within your mucosal membrane that is bleeding. So slow bleed is taking place. You're losing blood inside your body. Okay. Other chronic conditions, anemia that comes into existence because of some other condition, disease condition. Okay, if you are suffering from any inflammation, underlying inflammation for a very long time, okay, these in during when the body is under inflammation from a very long time, it produces certain inflammatory proteins, okay, that can repress your bone marrow. Okay, the way how bone marrow functions produces RBC that can be repressed. Okay, so these are the conditions, chronic inflammatory conditions in which your bone marrow may get repressed. Advanced kidney disease, chronic kidney disease, hypothyroidism, old age, cancer, infection, lupus. Lupus is also autoimmune disease, okay? Diabetes, rheumatoid arthritis. Okay, so these are inflammatory conditions which are long-standing. This can repress your bone marrow's functioning. Then anemia caused by destruction of red blood cells. When the red blood cells are very fragile, they cannot handle the stress of traveling through your body. Okay, so uh, they can completely burst out. Okay, and that is what we call as hemolytic anemia. And some there could be certain enzymes or proteins that are causing these red blood cells to burst. Okay, that can also happen. Like your own immune system can attack your red blood cells. In conditions like lupus and all, your own immune system will attack your red blood cells. It can happen to anyone. Conditions that can be passed down through your genes like sickle cell, anemia, thalassemia, thrombocytic or thrombocytic cytopenic purpura, TTP. These are conditions, genetic conditions, okay, in which red blood cells can burst. Large spleen, splenomegaly, okay. In this condition, the spleen can trap the red blood cells and destroy them way too early. Spleen is usually supposed to destroy your red blood cells, but the old red blood cells, the worn out red blood cells, those red blood cells have to be destroyed by the spleen, and spleen will take up the iron from the destroyed red blood cells, store it for future use. Okay. The remainder of the red blood cells will leave your body through your excreta. Okay, so that's how it functions. But if the spleen is larger than its size, even before the red blood cells become old, young red blood cells can also be destroyed way too early. Something that puts strain on your body, like infections, drug, snake or spider bite, venom bites, okay, certain foods as well. Toxins from advanced liver diseases or kidney diseases that can also, like liver are supposed to detoxify your body, but if liver is undergoing certain disease condition, these toxins will not be properly detoxified. Okay, that can be still out in your blood, and that can cause further destruction. Any grafts, heart surgeries, grafts, okay, prosthetic heart valves that have been kept, tumors, severe burns, okay. During your work or because of your occupation, you are around certain chemicals like lead and all, okay. Hypertension, severe hypertension, blood clotting disorders. In these situations as well, red blood cells can get destroyed. So diagnosis of anemia, CBC test has to be done, complete blood count, okay, and it will measure the red blood cells, hemoglobin, and other parts of your blood as well. Doctor will ask about the family history, the medical history after your complete blood count, and they will also do some tests including blood smear, reticulocyte count. Blood smear, just a drop of blood is taken, okay, and the size of it is smeared, it is stained and smeared, okay. Under the microscope it is checked to find out the size of the red blood cells, size of the white blood cells, shape of it, the color of it, the chrome of it, okay. Any unusual cells, if it is present or not, that blood smear can identify. Reticulocyte count, to check for immature red blood cells. Reticulocyte count is done. Then aplastic anemia, here you will require some medication, blood transfusion, or in some severe cases, if you get a transplantation done, that is better. Okay, that is for aplastic anemia. Hemolytic anemia, again, medication that can suppress your immune system because your immunity is attacking the RPCs. So if you're able to suppress the immune system, you can at least control hemolytic anemia. Blood, if there is any blood loss, internal blood loss that is happening, surgery has to be done to fix that blood loss, to stitch the wounded area or internal wounds. Okay, if it is worm infestation, deworming has to be done. Iron deficiency anemia, take iron supplements. Okay, diet has to be modified. For sickle cell anemia, painkillers are given, folic acid supplements, antibiotics, oxygen therapy is given. Sickle cell anemia, there is no cure for it. You have to treat it throughout the life. B12 and folate deficiency for pernicious anemia, supplements are prescribed. Thalassemia, usually treatments are not required, but blood transfusions, bone marrow transplant surgeries. Okay. There is no cure for thalassemia until and unless there is a transplantation, successful transplantation. Till then, blood transfusion will be used. Then anemic diet. To treat anemia, you have to eat iron-rich food. These are some of the food that has high amount of iron. Meats, red meat, more preferably, then lean meat, eggs, green leafy vegetables, iron fortified food. Okay, like cereals. Some masala powders today are also fortified with iron. Salt is fortified with iron, double fortified salt. Beans, seafood, peas, nuts, dried fruit, like raisins and all, walnuts, raisins, dates, lentils. Okay. These are the recommendation and not recommendation for anemic diet. Fruits that are rich in iron are pomegranate, watermelon, custard apples, tomatoes. Okay. Figs, dates. These should be consumed daily if you are anemic. Uh, Rajgira, nachini, that is ragi. Okay. Jaggery, beetroot. Cooking food in iron vessel, moringa leaves, drumstick leaves. Okay, that is moringa leaves. Include vitamin C with your iron supplements or iron-rich food for better absorption. Work out daily, brisk walk, etc. Milk and some dairy products that can also interfere with iron absorption. Overcooking of food that also destroys the nutritional benefits. Calcium, iron food should not be taken together, especially if the calcium in your meal is more than 250, 300 mg. Don't take it with iron supplements or iron-rich food. If calcium is below 200 mg to 50 mg in your meal, whatever you're having, then it's fine. Tea and coffee, avoid while having iron supplements or iron based meal. Gluten based meal also you can avoid during iron supplements while having iron supplements. Anything that is made up of maida, wheat, etc. Smoking, alcoholism, tobacco. Okay, that can also adversely impact your RBC formation. And if there is any severe blood loss like severe menstrual bleeding, peptic ulcers, internal bleeding, parasitic infection, that has to be treated. So supplements are available. Ferrous sulfate, it comes in liquid form, syrup form, tablet forms. Okay. Usually 325 mg is served. Consult a doctor about taking iron supplements for anemia. Okay. Even if your hemoglobin levels have come back to normal, you should not stop the iron supplements. You have to continue it at least for 1 more month. Okay. Typically, you can take it on empty stomach, but don't combine this iron supplements with milk, caffeine, or calcium supplements. Don't take it together. Take it with vitamin C based tablet, supplement, or a glass of citrus fruit juice that is rich in vitamin C, amla juice, orange juice. Okay. In pregnancy, body produces 30 to 20 to 30% more blood, which means you require more iron and more vitamins to keep up with the excess blood production. Okay, excess blood volume. So mild anemia is very normal in pregnancy. Every woman undergoes that. But if it is severe anemia, that can put your pregnancy as well as your baby at risk. Okay, mother and child both will be at risk. And there are high chances of having a preterm baby, low birth weight baby because of this. Then during pregnancy, 27 mg of iron each day should be taken. Better it is taken as a supplement. Any woman who had a history of gastric bypass surgery or a part of the stomach has been removed, or if there is any scar in your intestine, okay, it's better to take iron through IV because the intestine will not support the absorption of iron directly through intravenous needle, through injections. Just you can take iron supplements as well. Risk of anemia in pregnancy, neonatal risk, low birth weight baby, small for gestational age baby, fetal distress, preterm babies, etc. They come under neonatal risk. Offsprings, the child who is growing anemic or was born anemic. Intellectual disability may take place. Okay, memory issues, processing disorders, and for the mothers, preterm labor, placental abruption, that is, placenta is breaking down during the labor or before the labor itself, labor started, placenta broke off. That could lead to severe bleeding. Okay, and it's a maternal uh, risk as well. The mother can die because of that as well. Severe postpartum hemorrhage, again, that is a risk of maternal mortality with that. Preeclampsia, okay, the preeclampsia is high BP, edema, okay, proteinuria during pregnancy. Then hysterectomy, removal of uterus, maternal shock when there is a severe blood loss during pregnancy. Mother's body may go into a stage of shock, coma, okay. She may get admitted in the ICU, prolonged stay in the ICU, maternal death. These are the risk of anemia and pregnancy. So that's about anemia. If you have any queries, you can ask in the chat box.